valve prolapse into the VSD equals pulmonary hypertension. At VSD closure results in lower right ventricular and left atrial pressures and higher left ventricular pressures than pre-closure values. 28. CQ. VSD closure is contraindicated in patients with Eisenmenger syndrome. 3. Back collapse. Find text outline. Complications: arrhythmia, heart failure, Eisenmenger syndrome, infective endocarditis, aortic regurgitation. OOG. G. Atrioventricular septal defect, AVSD. Definition: 3. A defect of atrioventricular valves, i.e., mitral and tricuspid valves, as well as the atrial and/or ventricular septum, previously referred to as endocardial cushion defects. Complete form, ASD and VSD, common AV valve partial form, only ASD and minor AV valve abnormalities. Etiology plus strongly associated with Down syndrome __. 29,130. Association with maternal diabetes and obesity has been shown in some studies. 31. Pathophysiology. 3. Complete form, ASD and VSD, equals atrial and ventricular left to right shunt, excessive pulmonary blood flow and ventricular volume overload, pulmonary hypertension and heart failure. Partial form, ASD only, atrial left to right shunt, symptoms that may remain minimal until adulthood. In both forms, abnormal AV valve regurgitation in utero, heart failure, non-immune hydrospitalis. 32. Clinical features. 31. Complete form, see non-specific findings and heart failure in overview above. Plus partial form, see clinical features in atrial septal defect, ASD. 1. Diagnostics. 33. Antenatal echocardiography, findings of endocardial cushion defect in first trimester, screening for Down syndrome. Echocardiography, confirmatory test to assess defect size, shunt volume, and global cardiac function. ECG, left axis deviation due to LVH. Chest X-ray. Copyright. Complete form, global cardiomegaly, T. Pulmonary markings. Copyright. Partial form, enlarged right heart and pulmonary artery. 1. Treatment. 141 I331 I3. All patients. Provide medical management of acyanotic CHDs as needed. Surgical management, patch closure and AV valve reconstruction. WAOE. Patent foramen ovale, PFO. Description: a variant of cardiac anatomy in which the foramen ovale remains patent beyond 1 year of age. Epidemiology plus prevalence, 25% of the general population. 34. Etiology: associated with Louis-Steed syndrome. Pathophysiology plus failure of the atrial septum primum to fuse with the septum secundum following birth. Persistence of foramen ovale. Mild left to right shunt. Shunt reversal may be induced by certain maneuvers that increase right atrial pressure. Example: Valsalva maneuver, coughing. UVASD equals septal tissue deficiency. PFO equals enough tissue, but problems with fusion. Clinical features. Back collapse. Find text outline. Clinical features. Affected individuals are usually asymptomatic until complications occur. Diagnostics. 35. PFOs are sometimes an incidental finding during procedures. Example: PCI, cardiac surgery, or must be evaluated for after an embolic event. Example: ischemic stroke. TTE with agitated saline. Best initial test to evaluate for a right to left shunt. Indications for T with agitated saline. Copyright inconclusive. TTE. Copyright high index of suspicion for PFO despite negative TTE. Treatment. 10. Asymptomatic PFO. Treatment is not usually required. Plus confirmed PFO after embolic event. Example: ischemic stroke. 4L. Copyright requires multidisciplinary evaluation by cardiology and neurology to determine the likelihood of paradoxical embolism from PFO. Degree treatment may include antiplatelet agents or anticoagulation equals surgical or